Hi, welcome back. In the last video you saw how we touched on how a Medicare supplement works and how it protects you from all the gaps, commonly known as a Medigap policy through Medicare. So this is how a supplement works. Now what we're going to do is we're going to talk about what they call a Part C. Part C is an accounting term. You will never see it anywhere. But Part C is basically known as Medicare Advantage plans. These became very popular in 2005. So what the government did is they said, a lot of people, because you do have to answer health questions, are not going to qualify for a Medicare supplement. So we need to have something out there that is going to help people have lower costs, because not everybody can afford the supplement, and something that they could qualify for very easily. So what they did is they decided that they were going to take $800 to $1,000 per Medicare beneficiary and give it to the plan that you sign up for. So they went, as you can see, away from Medicare into the privatized industry, okay, and came up with a Part C that is consistent of your A, your B, and your D. So hospital coverage, medical coverage, and prescription drug coverage are covered under these Medicare Advantage plans. They get your $135.50 plus, depending on what their star rating is, the money from the government in order to help manage your health care. Now, you have then drawn a line between your doctor and Medicare. So there are no guarantees as far as getting the treatment. These are considered your HMOs, your PPOs, private fee-for-service plans, and point-of-service plans, depending on what area or what companies you're dealing with. Health maintenance organization, preferred provider organization, private fee-for-service, and point-of-service sales. Kind of a big alphabet soup going on. Seniors are very confused on how these work, so that's our job to make sure that we understand how these works. The most popular are the HMOs. These plans pay the doctor who is your primary care physician. They do have networks. So he becomes your gatekeeper for the client. Referrals are involved. Preferred provider, no referrals, usually come with higher costs. But the thing that they like about them the most are their low, or in a lot of areas, no premiums associated with these plans. They're not free, they do have co-pays, or what I like to refer to as cost sharings involved. Now these plans are one-year contracts. Every year, your client will get a book that says changes. So these are the changes in your plan. Maybe your doctor's not in it anymore. Maybe your co-pays went up, maybe they went down, but they do change on an annual basis. So we have what they call AEP coming up, annual election period, where people who are currently on these plans get to take a look at possibly either going back to traditional Medicare or finding a different company to help manage their health care. Now, by saying that, you can see that what drives where the client is going to be. The drug plan. So just as well as these Part C's are involved in annual election period, so is the Part D. So you have to switch the drug plan in order to guide the client of where they're going to be as far as how their Medicare is being managed. Now these also have a lot of rules associated with them. Since the plan is since the company is on the hook for what the bottom line is going to be, they may come up with an alternative on how to manage your health care. So they may say, we have time to approve that or not approve it. We're usually in traditional Medicare, as long as Medicare approves it, for sure, then supplement will pay instant care. Maximum out of pockets over here are what I like to refer to as stop losses. I can't speak for the whole entire country, but I know here in Florida, they range from $3,400 to $10,000 in and out of network. So it depends on what plan, what company you're with, Depending on what your stop losses or maximum out-of-pockets will be, once you hit that, the plan will pay for all the rest of your health care for the remainder of the year. So that's the differences of how a senior can manage their secondary coverage, whether it be through traditional Medicare or through a Medicare Advantage plan or a Part C.